If you're watching this on YouTube or I've floated by on my Moodle site, a very warm welcome. My name is Rory Lees Oakes and today I'm with Bob Cooke of the Manchester Institute for Psychotherapy. Again, here in my hometown in Manchester, in Chorlton today. And we're going to discuss depression. Bob's going to tell me his knowledge on depression, share it with yourselves. I think one of the interesting things, Bob, I was before we set the camera going, I was absolutely stunned. Did you say that depression is the biggest single word put on Google? Is that right?
That's correct. Yes.
Wow.
Yes, a bit. If you, I think if you're into Google Analytics or some of those tools, you would find out the number one mental health term often put into Google search engine, and I think YouTube as well, is depression. I often thought it'd be things like stress would be the most popular word, or anxiety, or even things like mental health, but depression is actually put into the search engine more often than any other mental health term that you could even think of.
Wow. I mean, that's amazing, and it's amazing, but I guess it's kind of sad as well, isn't it, that people may be out there looking for some solace or for some solutions. So you've got a lot of experience. You've worked for a long time as a psychotherapist, you trained psychotherapist. What is your take on depression? We hear a lot from, I guess, the TV and the media and drugs companies about what depression is. When I hear about it, it's kind of like a vague term. You meet people and they say, "How are you doing today?" I'm a bit depressed. And then I've worked in mental health where you've seen people who are clinically depressed, almost comatose and jammed up and unable to function. So I'm kind of wondering why this word has such a wide connotation. What is it? What's your take on it, Bob?
Yeah, well, I see many people for many different mental health symptoms. I assess a lot of people for psychotherapy and counselling. So, in my personal opinion, if we look at depression in terms of on a continuum, so we have the worried well, let's use that term, depression, and then perhaps people who are more anxious or perhaps have got a less robust adult, where depression is more of a fixed condition. So if I look at depression in the worried well section, I think that is, as the word said, they depress themselves. Now, you might have people who come along to my practice and say they feel down a bit, or they feel a bit out of colour one day. Usually when they say that, though, they're talking about a sense they can't actually higher their mood. They can't move out of that state. And that impinges on their relationships, their levels of functioning, or how they are in the world. So they come to me and they want to talk through how come they feel down, how come they're depressing themselves, and where that's come from, so they can empower and feel more lively in life, if you like. And then you get people who come here and talk about depression as a state of being. In other words, most of the time they stay in this down state and aren't able to function very well at all. So they may capacitate themselves, stay in bed, or they may stay agitated and have waking depression, or they may be taking so many drugs, if you like, that they find functioning quite limited. So you have a continuum. You have a continuum of depression, if you like.
So for those who are watching on the channel who are not kind of mental health professionals, when we use the term worried well, what does that actually mean?
That means people who function adequately in life, so they get on in life, they have relationships, they hold down jobs, but they still worry about certain aspects of their life, and they worry about how they're going to be in relationships, and they may worry excessively or to a state where they aren't enjoying life. But most of all, they have the capacity to be able to stay in the here and now and act in a spontaneous way. So that's why we call it worried well.
Yes.
If we move to the other continuum, it's when people have perhaps a disturbance, or they come from a position where they find it hard to stay in here and now, and either live in the past or live in the future, but they find spontaneity and staying in relationships and relating to other people difficult.
Yes.
That makes
it
sense.
Does.
It does. In a sort of easier way to explain that.
So it almost sounds like the worried well, almost innate, I guess if you use a Rogerian term, almost have a self-healing capability with support.
Correct.
Yes.
That's a very good way to put it.
Yes. Where people who are kind of living in the past or the future, would you say that was bordering on psychotic presentation, maybe?
Out of touch with reality.
Out of touch with reality.
Yeah.
No here and now. Yes.
Yeah.
So, two distinct presentations. One, a malady, if you like, where you might need some support and some way of offloading.
Yeah.
But the other, a bit more serious, where they can't harness their own kind of self-actualising tendency. So how would you work with that as a TA therapist?
Yeah.
Where would you start with somebody who was clearly on the brink or the borders of psychosis in terms of depression?
Okay, well let me tell you a story first.
Okay.
A very brief story
Yeah.
from a client that came to see me, I would say 7 or 8 months ago.
Okay.
And she came to see me and she sat on the other side of the settee. She was 42 years of age, presented quite well. She sat there. I said, "What do you want?" And she said, "I've come here, you're my last resort." So my heart sinks when somebody says that.
Hear that?
She said, "Yes, I've come from my doctors and I've been depressed since I was about 16 or 17. And I've been taking medication and Prozac and different types of antidepressant tablets for a very long time. I've tried CBT, I've tried different types of counselling. However, I stay depressed and I was recommended to your institute, and so I'm giving psychotherapy a shot." So I said, "Oh wow." I said, "Well, let me tell you a bit how psychotherapy works. First thing we're looking at, as well as processing how you are today, is how the past affects the present. So tell me a little bit about how you got on with your mum and dad. Did your mother, for example, suffer from depression?" Her eyes widened, and she sat up like that and she said, "Wow, I've never been asked that question." And then she thought for a minute or two, and I thought the world was going to collapse. It was like a moment of amazing euphoria, and she said, "Do you know, my mother was depressed."
Wow.
So I said, "Oh, tell me a little bit more than that." She said, "My mother was depressed all my childhood." So I looked at her and I said, it's one of these moments in life, Rory. I said to her, "Oh, well, your depression, and your mother was depressed, so whose depression do you think your depression was or is?" And she looked at me. After about 3 or 4 minutes, she said, "Do you know what? I've worked something out." And I said, "What?" And she said, "It's my mother's depression I've got."
Wow.
Yeah,
that's incredible.
That's incredible. And they said, "That's fantastic."
Yeah.
And I said, "Oh well, I'm glad you worked that out because it does lead to a very important revelation." She said, "What's that?" I said, "Well, maybe you could give it back to her then." And you'd think the world had collapsed around her, or I hit her with a boulder or something like that. She was quite startled, and then after another 5 minutes of thinking, she said, "Yes, I can give the depression back."
She took control of it.
She took control of it.
Yes.
So I said, "Great, I'll sign you to a therapist and for the next 10 sessions or whatever, and I would like you to go and give the depression back." And anyway, off she went. Anyway, I met her not long ago in the corridors, from one of the rooms to another room. I said, "Hey," oh, she stopped me, that's right. And she said, "I want to tell you." I said, "What?" She said, "I've given it back." So I said, "What are you giving back?" She says, "The depression." And she said, "I haven't got depression anymore." I said, "That's fantastic." I said, "What are you doing now, Peppy?" "Oh, I'm going on to other areas of life, but I actually feel so much lighter because now I can get on with life and feel more empowered, and the depression has gone back to where it started from.
Yes, he's giving it back.
Yeah, and I wanted to start with that story because it's what we can all do, whether we are in the. We need to trace our depression, see where it's come from, take control of the depression, take ownership of the depression, and let it go, give it back, or find a way to heal yourself through that. Now, it's going to be more difficult perhaps if you come from a place where you, like you just started, on the edge of psychosis,
yes.
or such a big, huge boulder or a big crevice that you fall into. But if we start looking at where the depression started, because we know what is born depressed. I've done a tremendous lot of infant research,
yes.
and that is a fact. So, the environment is partly responsible for how we depress ourselves.
I mean, I think that a lot of people watching this will find that so useful. The idea that it's not something that you're born with, it's something that you acquire.
That's correct.
Yes.
We haven't got a gene that is depressed.
Right.
I mean, they're poured with, amounts of money into looking at finding a depressive gene.
Yes.
And to my knowledge, they never have. And even if they have found some research that supports that, there's a tremendous lot of research that doesn't support that. And anyways, how we then cope with that process. But from my viewpoint and my professional experience, this is a process we acquire, which means we can change.
Yes.
But that's a bit of a pattern therapy, and I'd say the more hard you and fixed you are into the depression, it may take longer for you to resolve and heal this process.
Sure.
But it's certainly one of the most common conditions that I work with. But the really, really important process here I wanted to talk about is that people can change and give back the depression, or at least take a sense of responsibility over the depression. It's not something we have to stay with all our lives.
I mean, I think that's just quite a powerful statement. This notion that, I'm sure there'll be people watching who may be depressed. We started off, didn't we, by talking about people searching for that. And I'm sure that once we put this on YouTube, people will come to this.
Yeah.
So this notion that you don't have to be like that.
No.
It can be something that can be worked with and altered.
Yeah, if you go to many doctors, and you talk about depression, perhaps some of the doctors might say there's two types of depression: reactive depression and indigenous depression. So, reactive, in their theory, is that it's a depression which you've acquired, and there's a sense of reactivity to it.
Yes.
And there's an indigenous depression, which in their theory again is one which is more genetic. Now, I personally don't see much evidence to support genetic depression.
Right.
So I'm talking about acquired or reactive depression, which is a really important thing. The other thing about depression, of course, and I think a lot of doctors are getting more enlightened, but if they simply listened to the people who came and acquired just for a few minutes about how the past affects the present, I think they will start learning that counselling, which I know you do,
absolutely,
is very useful for depression, and so is psychotherapy. And then, if they could just, instead of giving out drugs, could give them a year's membership to a gym, this would really help.
Yes.
Because we all know that if you can change endorphin levels in somebody's brain structure, and modern research says this, you will for a time get better.
Yeah. I mean, it's quite interesting, the debate on in the 80s, it was pills versus skills. There was a huge debate when Eli Lilly, the pharmaceutical company, launched Prozac. And I wonder, because I'm sure there'll be people watching this who are taking medication, and my personal view, it has a place in the lexicon of treatment.
Sure.
Where are you with the idea of the use of Prozac or the modern kind of antidepressants?
Well, I'm quite clear with it here,
Mm-hmm.
but I think drugs can and has a useful part in the world of counselling psychotherapy, and for people generally, in terms of functioning.
Yes.
And helping people functioning and getting on with life. However, if they just stay with medication and drugs, that's exactly what will happen. They'll just function,
Mm-hmm.
and a large dimension of their energy and vitality will often get missed. And the other thing is side effects with a lot of these drugs will dampen a lot of the person's spirit. They'll stay quite flat. Some of their vitality will be lost. So it's not something I would recommend for a long period of time. Useful for levels of functioning.
Sure.
If they're incapacitated or in a place of feeling down and they can't
Sure.
move from that position.
And I'm conscious again that we're going to have viewers, I'm sure, who are long-term users of antidepressants, and I don't think for a minute that we're recommending that people stop using them.
No, I didn't.
Yeah, I'm sure that's the case, but I think it's useful just to make that clear.
Yeah, because their level of function is really relevantly important.
Absolutely.
And I'm not saying that at all. I'm saying that I think you can look beneath
Yes.
this whole process in terms of gaining vitality and empowering your life, so you can actually move away from perhaps a dependency on these types of drugs. I'm not saying that we shouldn't use drugs, because clearly in terms of functioning and changing some of the dopamine and endorphin levels in the neurological systems, in that sort of chemical way we're talking about, plays a part.
Absolutely.
So I'm glad you mentioned that. I don't want viewers to think.
No, I'm sure that's not the case, Bob.
But I think there is a place for talking
Sure.
through and taking charge of and ownership of depression, because sometimes by just giving over ourselves, if you like, to tablets, it means we're moving away from taking responsibility for our lives and the fact that we can change our lives.
And I guess that might be hard for some people watching, if they're in the midst of depression, they're on medication, to hear that, to take charge. What's the first step then? What's the first step of someone taking charge of their life and taking this acquired malaise? What's the first step?
Begins with an M, Rory.
What's that?
Motivation.
Motivation.
Yeah.
Okay.
They have to find motivation to change.
Sure.
That they want something better in their lives, and then they pick up the phone, even if it's only to talk to a friend.
Right.
Even if it's only to talk to somebody on the end of the phone and say, I want to get out of this place that I'm in.
Right.
Help me. So the first step is reaching out for help.
Yes.
Because by doing that, you're taking ownership of change. The worst thing is to stay insular, internal, stuck inside a dark void, not reaching out. Because if you stay in that place, what will happen is you'll end up in a black hole, basically.
Sure.
You need to reach out. That's the first step.
Sure.
Then, after you've reached out, you've got another step. And the next step is to go and get some professional help.
Sure.
Now, if there's not professional help around at the moment, talk to friends, talk to people. But eventually, go to the doctors, find out if there's a counsellor's attached to the doctors.
Absolutely.
Take medication if it helps you function.
Sure.
But reaching out is the first step.
I mean, I'm really struck with the power of what you've said. There's lots of books written, there's lots of discussions, for those people who watch TV, it's something it's kind of endlessly discussed, depression. But for me, hearing this, such a simple thing as picking up the phone and speaking to someone, maybe like, if you haven't got any close people, maybe like the Samaritans.
Yes.
We'll put the number on the end of the presentation.
That's really good.
Or getting some help, just to talk to someone, just to connect.
Just to connect.
Yes.
Rory. That's the bit, to
Yes.
connect. So you're not the only person in the world. Some other people out there who not only are prepared to talk to you, but will listen to you. And so you're not alone in this black void.
Yes.
Reach out is my really mantra for anybody who feels depressed, that there's other people out there that will listen to you, that life can change. You're not all alone in this.
And we've seen this, as therapists we've seen this.
All the time.
Yeah.
Yeah. So I'd like to end really on that plea, Rory, that I want all people out there to reach out and believe in a better life.
And on that quite existential note, my learners are watching now, they'll be laughing because I always end existential note. Thank you, Bob.
Thank you very much.
And we'll put the Samaritan's phone number on the end of the presentation. So anybody watching, if you need, as Bob quite passionately said, just to reach out, there's someone you can speak to. And if you're watching out there, look after yourself, and thank you for watching.
Bye bye.